10 Common Signs of Cholesterol You Should Not Ignore. Cholesterol, a type of fat found in your blood, is essential for building healthy cells. However, when you have high cholesterol, especially low-density lipoprotein, LDL, or bad cholesterol, it can accumulate on the walls of your arteries, leading to a host of cardiovascular issues. High cholesterol is notorious for being symptomless until it causes significant damage, which is why many people remain unaware of their condition. However, some subtle signs and associated health issues can act as red flags. Here are 10 common signs of high cholesterol that you should not ignore. 1. Chest pain. Angina. One of the most common and well-known signs of high cholesterol is chest pain, often referred to as angina. Angina occurs when the arteries that supply blood to the heart muscle become narrowed or blocked by cholesterol deposits, making it difficult for oxygen-rich blood to reach the heart. This lack of oxygen to the heart muscle results in a tight, squeezing, or burning sensation in the chest, which can also radiate to the neck, arms, jaw, back, or even the stomach. The discomfort of angina typically worsens with physical exertion or stress and subsides with rest. While angina itself may not directly cause a heart attack, it is a critical warning sign that should not be ignored, as it indicates an increased risk of coronary artery disease, CAD. CAD is caused by the gradual buildup of cholesterol, leading to atherosclerosis, a condition where the arteries harden and narrow, reducing blood flow to the heart and other vital organs. If you experience chest pain, particularly during activity or stress, seek medical advice immediately, as early intervention can prevent more severe complications like heart attacks or strokes. 2. Pain in the limbs. Peripheral artery disease. Another subtle yet serious indicator of high cholesterol is pain in the limbs, particularly the legs, which may occur as a result of peripheral artery disease, PAD. PAD is a condition where cholesterol and other fatty substances build up in the arteries outside the heart, often in the legs and arms, restricting blood flow to these areas. This condition usually manifests as cramping, numbness, weakness, or discomfort in the muscles of the legs or arms, especially during physical activities like walking or climbing stairs. The pain typically subsides with rest. PAD is often mistaken for muscle strain or arthritis, but it is actually an early sign of more widespread atherosclerosis, which can eventually lead to heart attacks or strokes. Over time, untreated PAD can lead to critical limb ischemia, a severe blockage in the arteries that drastically reduces blood flow, resulting in non-healing sores, infections, and in extreme cases, amputation. If you frequently experience leg pain, numbness, or cramping during activities, it's essential to see a healthcare provider who can assess whether high cholesterol is contributing to PAD and offer appropriate treatment. 3. Xanthomas. Fatty deposits on the skin. A visible and often overlooked sign of high cholesterol is the presence of xanthomas, which are yellowish or orange fatty deposits that form under the skin. Xanthomas can appear anywhere on the body, but they are most commonly found around the eyes, elbows, knees, hands, and feet. These deposits occur when cholesterol and fats leak from the blood into the skin due to elevated cholesterol levels. Xanthomas can vary in size, from small nodules to large lumps, and while they are usually painless, they are a cosmetic concern and an indicator of dangerously high cholesterol levels. Even though xanthomas do not cause any discomfort or immediate health risk, they are a clear sign that your body is struggling to manage fat metabolism, and untreated high cholesterol could lead to severe complications such as heart disease or stroke. If you notice any abnormal lumps or bumps under your skin, especially if they are yellow in color, consult a healthcare professional for a cholesterol test. 4. Yellowing of the skin around the eyes. Xanthelasma. Xanthelasma is a subtype of xanthomas that occurs around the eyelids and is another visible sign of high cholesterol. These yellowish, flat plaques appear on the upper or lower eyelids and can be a direct indicator of high cholesterol levels, particularly high LDL, cholesterol or triglycerides. While xanthelasma is typically harmless and does not affect vision, it's important not to dismiss it as a cosmetic issue because it points to an underlying lipid disorder. People with xanthelasma are at higher risk for cardiovascular problems, including heart attacks and strokes. In many cases, these yellow patches around the eyes are one of the first visible indicators of lipid imbalances in the body. Early detection and management of high cholesterol can prevent the progression of cardiovascular disease. If you notice yellowish spots around your eyes, especially if you have a family history of high cholesterol or cardiovascular disease, schedule an appointment with your doctor for a lipid panel to check your cholesterol levels. 5. Erectile dysfunction, ED. For men, erectile dysfunction can be an early sign of high cholesterol. The buildup of plaque in the arteries doesn't only occur in the heart but can also affect the arteries supplying blood to the penis. When these blood vessels are narrowed or blocked, it can lead to difficulty achieving or maintaining an erection. Since high cholesterol contributes to reduced blood flow, erectile dysfunction can be a red flag for atherosclerosis, a condition where arteries harden and narrow due to plaque buildup. Men experiencing erectile dysfunction should consider having their cholesterol levels checked to determine if high cholesterol is playing a role. 6. Fatigue and shortness of breath. Persistent fatigue and shortness of breath during normal activities can indicate that your heart is struggling to pump blood efficiently due to cholesterol-related artery blockages. When arteries are narrowed by cholesterol buildup, your heart has to work harder to push blood through, which can leave you feeling constantly tired or winded, even during light exertion. While fatigue can be attributed to many causes, if you experience unexplained exhaustion, especially alongside other signs like chest discomfort, it could be a sign of high cholesterol and its impact on your cardiovascular system. 7. Numbness or tingling in extremities. High cholesterol levels can lead to a condition called atherosclerosis, where plaque accumulates in the arteries and reduces blood flow to different parts of the body. This diminished circulation can cause numbness or tingling, especially in your hands and feet. If you frequently experience sensations of numbness or tingling in your extremities, it could indicate that your blood flow is compromised, potentially due to high cholesterol. This is a serious warning sign that should prompt immediate action, as prolonged restricted blood flow can lead to tissue damage. 8. High blood pressure. High cholesterol and high blood pressure often go hand in hand. When cholesterol builds up in the arteries, they become less flexible and narrower, forcing the heart to pump blood with greater force to push it through the restricted pathways. This increases your blood pressure and puts extra strain on your heart. High blood pressure can develop with few or no symptoms, but it's a strong indicator that your cholesterol levels may be elevated. Monitoring your blood pressure regularly is an important part of managing your cardiovascular health, especially if you're at risk for high cholesterol. 9. Vision problems. Retinal vein occlusion. Cholesterol plaques can affect the small blood vessels in your eyes, leading to a condition known as retinal vein occlusion. This occurs when a vein in your retina becomes blocked, preventing proper blood flow and causing sudden vision problems, such as blurriness, floaters, or even partial vision loss. If you experience any sudden changes in your vision, it's crucial to seek medical attention immediately. Retinal vein occlusion is often a sign of underlying cholesterol issues and could signal a greater risk for cardiovascular problems like stroke. 10. Stroke or mini-strokes, TIA. A stroke or transient ischemic attack, TIA, often referred to as a mini-stroke, can be one of the most severe consequences of untreated high cholesterol. High cholesterol leads to the buildup of plaques in the arteries supplying blood to the brain. If a piece of plaque breaks off, it can block a blood vessel, leading to a stroke. Symptoms of stroke include sudden weakness or numbness in the face or limbs, often on one side of the body, confusion, difficulty speaking or understanding speech, vision problems, and dizziness. TIA, though temporary, is a warning sign that a major stroke could occur in the future. If you experience any of these symptoms, it is a medical emergency, and you should seek help immediately. What do you think of our video? Let me know in the comment section below. Before you go, please hit the like button and subscribe to my channel. Thanks for watching.